Today, we're talking about Evekeo, a medication used to treat attention deficit hyperactivity disorder, ADHD, by changing the amounts of certain natural substances in the brain. It belongs to a class of drugs known as stimulants and can help increase your ability to pay attention, stay focused on an activity, and control behavior problems. It may also help you to organize your tasks and improve listening skills. In addition to treating ADHD, Evekeo is also used to treat a certain sleeping disorder called narcolepsy, helping people stay awake during the day. However, it should not be used to treat tiredness or to hold off sleep in people who do not have a sleep disorder. Furthermore, amphetamine may be used along with a doctor-approved, reduced-calorie diet to help significantly overweight, obese, people lose weight. It should only be used for a short time, a few weeks, in people who have not lost enough weight with other treatments, such as dieting, other drugs, or group programs. It may work by decreasing your appetite. It is important to follow your doctor's instructions regarding the daily dosage and the best time to take this medication, as they will tailor the treatment plan to your specific needs. Make sure to read the medication guide provided by your pharmacist before you start taking Evekeo, and every time you get a refill. Take this medication by mouth with or without food as directed by your doctor, usually 1 to 3 times a day. The first dose is usually taken in the morning when you wake up. If more doses are prescribed, take them as directed by your doctor, usually 4 to 6 hours apart. If you are using Evekeo for weight loss, take it as directed by your doctor, usually 30 to 60 minutes before each meal. Use Evekeo regularly to get the most benefit from it, and take it at the same time each day to help you remember. Avoid taking Evekeo late in the evening as it may cause trouble sleeping. If you suddenly stop using Evekeo, you may experience withdrawal symptoms. Your doctor may lower your dose slowly to help prevent withdrawal. Talk to your doctor if Evekeo stops working well for you, and make sure to take it exactly as prescribed to lower the risk of addiction. If your condition does not improve or worsens, be sure to inform your doctor. Possible side effects of Evekeo may include nausea, stomach upset, diarrhea, dry mouth, headache, nervousness, dizziness, trouble sleeping, loss of appetite, weight loss, irritability, or restlessness. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Evekeo may also raise your blood pressure, so it's important to regularly check your blood pressure and inform your doctor if the results are high. Contact your doctor immediately if you experience any serious side effects such as signs of blood flow problems in the fingers or toes, unusual wounds on the fingers or toes, changes in mental/mood/behavior, uncontrolled muscle movements, swelling ankles/feet, extreme tiredness, changes in sexual ability/interest, frequent/prolonged erections, or vision changes. In rare cases, Evekeo may increase serotonin and cause a serious condition called serotonin syndrome/toxicity. Get medical help right away if you experience symptoms such as fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea/vomiting/diarrhea, twitching muscles, unexplained fever, or unusual agitation/restlessness. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed, contact your doctor or pharmacist. Using Evekeo improperly or abusing it can lead to severe, and possibly deadly, heart and blood pressure issues. It's important to only use this medication as directed, as it can be habit-forming. If you find yourself using Evekeo for an extended period, you may develop a dependency and experience withdrawal symptoms when you stop taking it. Always consult with your doctor or pharmacist for more information. Remember, the proper use and dosage of Evekeo is crucial for its effectiveness and safety. Before taking Evekeo, make sure to inform your doctor or pharmacist about any allergies you may have, especially to other sympathomimetic drugs. It's also important to discuss your medical history, including any blood circulation problems, high blood pressure, glaucoma, heart conditions, mental health conditions, substance use disorders, seizures, stroke, overactive thyroid, and any medications or herbal products you are currently using. Evekeo can cause dizziness, and using alcohol or marijuana can make it worse. Avoid driving or operating machinery until you know how this medication affects you. It's also important to discuss alcohol or marijuana use with your doctor. For children, Evekeo may cause weight loss and slow down their growth. Your doctor may recommend stopping the medication from time to time to reduce this risk. Older adults may experience side effects such as chest pain, trouble sleeping, or weight loss more intensely. If you are pregnant or breastfeeding, discuss the risks and benefits of using Evekeo with your doctor. It's important to monitor newborns for mood changes, agitation, or unusual tiredness if the mother has been using this medication. Breastfeeding is not recommended while using Evekeo. It's important to be cautious of potential drug interactions that could affect how Evekeo works or increase the risk of serious side effects. This means it's crucial to keep a list of all the products you use, including prescription medications, over-the-counter drugs, and herbal products, and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking MAO inhibitors, such as isocarboxazid, linezolid, or phenelzine, with Evekeo, as it could cause a serious and possibly fatal drug interaction. It's also important to steer clear of certain products that could raise your heart rate or blood pressure, such as cough and cold medications, diet aids, or NSAIDs like ibuprofen or naproxen. Be sure to discuss with your pharmacist how to use these products safely. Additionally, the risk of serotonin syndrome/toxicity increases if you are taking other drugs that increase serotonin, such as certain antidepressants or street drugs like MDMA. It's important to be cautious when starting or increasing the dose of these drugs while taking Evekeo. It's also important to note that amphetamine, the active ingredient in Evekeo, is very similar to dextroamphetamine or lisdexamfetamine, so it's crucial not to use medications containing these substances while taking Evekeo. Furthermore, Evekeo may interfere with certain medical or lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are using this medication. If someone has taken too much Evekeo and has serious symptoms such as passing out or trouble breathing, they should call 911 immediately. Otherwise, they should call a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222. Canada residents can call a provincial poison control center. Symptoms of overdose may include severe or persistent headache, severe mental/mood changes, seizures, severe restlessness, and rapid breathing. It's important to seek help if any of these symptoms occur after taking Evekeo. It is important not to share Evekeo with others as it is against the law. Your doctor may also recommend regular lab and medical tests, such as monitoring blood pressure, pulse, and children's height and weight, while you are taking this medication. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Evekeo, take it as soon as you remember. However, if it's getting late in the afternoon or close to the time for your next dose, it's best to just skip the missed dose. Take your next dose at the usual time and do not take extra to make up for the missed dose. Remember to store Evekeo at room temperature, away from light and moisture, and make sure to keep it out of the reach of children and pets. When it's expired or you no longer need it, be sure to properly discard it as directed by your pharmacist or local waste disposal company. And never flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.